What inspired you to become an oncologist and what motivates you to continue working in this field?
Long time back, our founder director, Dr. Krishnan Nair, when he was working as an oncologist in the Medical College Hospital in Trivandrum, when he used to go out for meetings, he used to find lot of our patients, that is from Kerala and Tamil Nadu and all those things, places. They used to, and Tata Memorial Hospital at Mumbai used to be the main stay hospital for oncology. So when he went and saw our people there, they used to stay in the footpaths of Bombay to take treatment, oncology treatment. That's not for 1 or 2 days because they couldn't afford hotels and all those things. They used to stay in the footpaths in the streets to take treatment. That's for weeks together. So that is what inspired him to start an oncology center, and which, if he took oncology as such a serious thing and he could do so much things, I knew that there was much more to this, and so after my MBBS, he was my main inspiration to come into oncology. And as far as continuing this is my job, first of all, and then this is one field where many other people do not have any idea to treat, because if you take a common a physician or a regular surgeon, they wouldn't have an idea of how to treat an oncology patient. So in an area where many people do not know how to treat, if you have a really good comprehensive idea of how to treat these patients, it will do a lot of things it means a lot of thing for the cancer patient. So that is my main inspiration to remain in this field and to continue my.
Can you tell us about your experience working with cancer patients and what you have learned from them?
Exactly, as you asked, rather than what we have learned in our as a subject as such. So it is when you interact with these cancer patients that you learn a lot how to treat them. Not only you know that there are specific modalities of treatment like surgery, radiation, chemotherapy, all these things are there for the treatment. But it is when you interact with these patients, talk to these patients, you have to come up with a treatment protocol which is best suited for this patient. It's a prolonged treatment, it's not just a one-day treatment. If they have to do surgery, if they have to do radiation, chemotherapy, it is almost like 4 to 6 months of treatment.
How has the field of oncology evolved over the years, and what advancements have you seen in cancer treatment and care?
Advancement, I think oncology is probably one field where advancement has been happening almost every other day. Some advancement is being made in oncology care. Previously, just a surgery, what we would do is, it used to be a regular surgery where you remove the cancerous part. But now they have come up with robotic surgery, endoscopic surgeries and all those things. That is the surgical part. And in radiation, previously we used to treat with a machine called the Cobalt machine. From this we have evolved to linear accelerators. Cobalt used to be a radioactive isotope with which we treat radiation. And the treatment which you could give with Cobalt machine was very limited. Then you started developing what is called as the linear accelerators, where you treat with X-ray machines. And these X-ray, and from chemotherapy, the regular chemotherapies which used to be very toxic, they have evolved and come into targeted treatment, they have come into immunotherapy and all.
What are some of the most common types of cancer that you see in your practice, and how do you approach treatment for each type?
Okay. Fortunately or unfortunately, we have been practicing a clinic system in our institution since the last 22 years. So in which a group of doctors see only head and neck cancers. Then there is a group of doctors who see the breast cancers and the brain tumors. Then another group of doctors see only the chest diseases and the colorectal cancers. And there's another group of doctors who see only genitourinary cancers. Head and neck cancers, gynecological cancers, breast cancers, lung cancers are all these are the different type of tumors that we see every day. And as far as treatment decisions are concerned, we do not take individual decisions. We have what is called as a medical tumor board. The tumor boards are there every day. All the new cases and all even the old cases would require discussion for treatment. All these are discussed in a one tumor board where there is a radiation oncologist, a clinical oncologist, and a medical oncologist. We all sit together and then we take a decision on each treatment.